Hi everyone, how are you today? Again, I'm Shaquana and I'm a community health educator at the Center for Community Alternatives.
And my name's Olivia, and I'm also a community health educator with the Center for Community Alternatives.
We're so excited to be back this week with you all. Thank you so much for your participation last week.
We hope you enjoyed our first lesson about male reproductive anatomy, as well as our mini quiz challenge from last week. Today we're going to be jumping back into reproductive anatomy, part 2, which is going to be all about the female body.
So today we'll be going over the female reproductive system, reviewing the structures of the vulva and the uterus, and completing the female reproductive anatomy worksheet.
Similarly to our first lesson, everybody should receive a workbook that you'll use to follow along during this lesson.
When you have completed the workshop, please make sure you fill out the participation questions so that you can get your participation credit and your participation certificate, and make sure you fill out any questions you have in the question box and turn these last sections of the worksheet packet into the coordinator so they can be sent back to us.
Alright, so let's get started. Please flip to the first page in your packet. In the first lesson about male reproductive anatomy, we talked about the male body and the male reproductive system.
Today we'll be starting with part 2, so we'll be talking about the female body and the female reproductive system. Again, we're going to start off by asking you all to think a bit about any slang or nickname terms that you've heard for vagina and or vulva.
These can be any words, good, bad, funny or strange, just anything you've heard or used that ultimately means vagina or vulva. So we're going to give you 30 seconds to think, and you can write down your responses in your worksheet.
So what did you come up with for vagina and vulva? For many of these, we've heard often terms like pussy, vag, snatch, cookie, punani, twat, gash, or bearded clam.
So, is there anything that stands out to you about any of these terms or any of the ones that you wrote down?
Anything different or similar about them?
Did anyone write anything that they would consider to be a positive word? How about a negative one?
Did you notice any patterns? We hope you all found this activity to be entertaining, and we wanted you to just think about the names and slang terms that we use to talk about vagina and vulvas.
Again, we recognize that some folks might find it easier or less embarrassing to say these nicknames than to actually use medically accurate terms like vagina or vulva.
While it's okay for you to use whatever terms make you feel comfortable when you're describing your private parts, there is nothing embarrassing about using the medically accurate terms as well.
Although it might feel a little awkward at first, these are our bodies, and knowing medically accurate terminology can help some people feel empowered or more comfortable talking about their own bodies.
Today we're going to go over the internal and external structures of the female anatomy. So let's flip to the next page of your workbook, and in this section it has 2 worksheets. The first sheet illustrates the uterus, which is the internal structure of the female anatomy, while the second sheet illustrates the external structure of the female anatomy, called the vulva.
You can see there is a word bank at the bottom of the worksheet full of the medically accurate terms for the parts of the vulva or the uterus. On the diagram, you'll see numbers and definitions. Match the number and its definition to the correct term at the bottom of the page.
Use the definitions to help you figure out the name and function of these structures. We're going to give you 3 minutes to complete both of the worksheets, and then we'll go over the answers together. So how did that go? Did anything surprise you? I know it had to be interesting, right? Let's get started, and we're going to start with the uterus anatomy worksheet first, okay?
The first one is your freebie, and that's the uterus. This is also referred to as the womb. The uterus houses and protects an embryo, fetus, or baby, and if someone is pregnant, the uterus contains and nourishes the embryo or fetus before birth.
Number 2 is the fallopian tubes. These tubes provide a passage for the ova or the egg towards the uterus. This is where the sperm and the egg will meet and fertilize the egg.
Number 3 is the ovaries. This is where ovum, or eggs, are stored. It's also where eggs mature. The ovaries also produce hormones like estrogen. Again, the purpose of the egg is that it is the biological contribution to the creation of a new person.
And a fun fact is, people with uteruses have all of their eggs when they are born, but they do not start releasing them until puberty. So the average number of eggs a person is born with is 20 million eggs.
Okay, so number 4 is the cervix. And this is the lower part of the uterus. It's a strong muscle that allows for the flow of menstrual blood out of the uterus and directs sperm into the uterus.
Number 5 is another freebie. It's the endometrium, which is an inner layer of tissue that is shed during menstruation.
All right, and the last one on this worksheet is number 6, the vagina. The vagina is an elastic, muscular canal with soft, flexible lining that provides lubrication and sensation. It also provides a passage for fluids that cleanse and lubricate to help sperm travel, for endometrial shedding during menstruation, and for babies during birth.
The vagina also has many nerve endings, meaning that it is very sensitive and provides sensation. Great job, everyone, on that last one. I know some of them might have been a little bit surprising to you. Now we're going to move on to the external anatomy.
On this side, we're going to be going over the anatomy of the vulva. Like we mentioned before, the vulva is the outer part of the female anatomy.
So let's get started. Number 1 is the clitoris. The clitoris is a small, sensitive part of the female genitalia. The clitoris has thousands of nerve endings and becomes swollen when it is aroused. The sole purpose of the clitoris is pleasure. Everyone's clitoris is different, meaning it can be as small as a pea or as big as a thumb.
Number 2 is the urethra. The urethra carries urine from the bladder outside of the body.
And a fun fact for everyone, I'd like to ask you, do you remember who else has a urethra? That is right, people with penises as well. So that is something that is a similarity between people with penises and people who have vulvas and vaginas.
Number 3 is the vagina. Now we've mentioned the internal structure of the vagina before, and on this diagram, we are looking at the external opening of the vagina. It's located right under the urethral opening, and this is where menstrual blood leaves the body, where babies are born through, and where vaginal sex occurs.
Now let's get into number 4. This is called the labia minora, and is also called the inner lips. They're sensitive and swell when someone is turned on or aroused.
Number 5 is the labia majora, and these are called the outer lips. They're usually fleshy and covered with pubic hair, and they can vary in color, shape, and size. Some people have larger inner lips than their outer lips.
Lastly is the anus. Like we said before, with the male anatomy, the anus is the opening to the rectum where feces is expelled. The anus has a lot of nerve endings, and that means that it's also very sensitive. So some people experience sexual pleasure from anal stimulation.
And with that, we've completed the uterus and vulva anatomy worksheets. Again, if you have any questions about any of the things that we went over today, be sure to write them down in the question box in your workbook and submit them to us so we can answer it in our next video.
And just like before, here are some fun facts before we wrap up this section.
Some of you may have heard of the hymen, and while it's not located on your vulva sheet, we just wanted to tell you a bit about what it is.
The hymen is a membrane or a thin layer of tissue that can partly cover the vaginal opening.
Many people may or may not be born with a hymen, and it can tear at any point without any type of penetration.
Riding bikes or horses can sometimes cause the hymen to tear.
Also, as folks go through puberty, they'll begin to grow pubic hair around their genitals, and that's totally normal.
Lastly, I want to mention one more time, genital size does not matter. Just like the penis comes in different sizes, the vulva and vagina can be different sizes and shapes as well. Also, the vagina is a muscle that does not stretch out. As always, we want to thank you so much for your participation. Hope that you all were able to learn something new from this.
Today we learned about the female reproductive anatomy. We reviewed the structures of the vulva and the uterus, and we completed the female reproductive anatomy worksheets.
Before you all finish up, as a reminder, make sure you take some time out to fill out the participation questions in order to get your attendance credit and your participation certificates. And if you have any other questions, comments, suggestions, please head to that question box at the last part of your packet. And once you're done with those 2 sections, you can hand them into the coordinator to be sent back to us. And with that, just thank you so much, and we'll see you all soon.
Thanks, y'all. We'll see you again soon.